Hello, greetings from Amsterdam. Before I talk with you a little bit about why Joinvasc won, it's probably a good idea to dive into a little bit of what the prize is about. The Value-Based Healthcare Prize has been founded 8 years ago. It is chaired by me, and we have an honorary chair, which is Professor Porter. The prize over time has had many winners, so from that angle Joinvasc has joined a great group of winners who are inspiring everybody else, because Joinvasc did a wonderful thing that I'm going to talk to you about, but also all the other winners have been inspiring the community and have also achieved the recognition that Joinvasc has had. The prize itself is granted by Value-Based Healthcare Center Europe. It's granted by Erasmus University in the Netherlands and the Top Clinical Hospitals Association in the Netherlands, but it has grown from the early years to an international prize. And we're very, very happy that, Brazil has now twice won something, but Joinvasc has won the big prize. Now let me talk with you about Value-Based Healthcare Center Europe for a second. Value-Based Healthcare Center Europe is basically grown out of my mailbox. When we started implementing value-based healthcare projects, it turned out that many doctors, many professionals, many managers and policymakers wanted to know how do you implement value-based healthcare. And we all know it's a journey. Joinvasc has been on that journey from 1995 actually, and has for the last couple of years been following some of the programs on the Value-Based Healthcare Greenbelt, and we know they have been active members ever since, and it's very, very good to see that Joinvasc has ultimately won. Now, how does the winning work here, apart from certification, apart from membership that may help, that may not help, but we have an international jury of pioneers of the early days of value-based healthcare implementation. And we had a whole nomination round, and ultimately there was a choice by this jury to determine who's going to be the winner of the prize and of the award. Now let me talk with you about why Joinvasc won. Joinvasc won for a couple of reasons, but basically it won because it has this stroke program, as you well know, but it's a community-based stroke program. We see many stroke programs around the world. They're always applying more and more value-based healthcare concepts, but the unique thing of Joinvasc is that it has been so effective in dealing with stroke and involving the community and being community based. So that was actually the prime reason. The other reason is Joinvasc has shown, with the help of many of you I think, has shown that if you have this IPU team effort, that you really can A, reduce stroke, B, if people are hit by stroke, that they get to the hospital fast, that the treatment is fast during that treatment, but of course that the main thing is how does it work after your stroke as well? How can you involve the family? How can you involve the community? That has been impressive. What has even been more impressive is that Joinvasc has been so active with many of you in prevention and early signaling stroke signals, contributing to lower stroke consequences and less severe cases. And ultimately what we see around the world is so important in healthcare is that we reduce our cost per patient cycle. And Joinvasc has shown with the whole team that they've done that by focusing on that in the team learning, by constantly improving everything they can improve, and be very much data focused in making sure that both outcomes and cost will be reduced. So I hope you will enjoy the story of Joinvasc. We've seen many people around the world and in our community now looking at the videos of Joinvasc, reaching out. We use it in our programs, and we make sure that everybody sees it. There's an important other thing that I think makes Joinvasc should be even more proud than they rightfully are already, and that's the fact that not only, let's say, the jury decided that Joinvasc should be this 2021 year's Value-Based Healthcare Prize winner, but also the Value-Based Healthcare community voted and awarded the community award to Joinvasc. So we can see that both the people who are crazy about value-based healthcare and implementation and have spent many years on that, thought Joinvasc would be the winner, but also that people voted before and people during the Value-Based Healthcare Prize session also voted for Joinvasc. If you're interested in that session, with many great examples and stories about value-based healthcare, about the other nominees, about the competition that Joinvasc sort of beat in the end, you can certainly look at Value-Based Healthcare Centre Europe's platform and look at the other nominees. I strongly recommend you anyway to reach out to Value-Based Healthcare Centre Europe if you're interested in implementation of value-based healthcare. We have now over 1,200 cases available of successful value-based healthcare implementation. And that will hopefully inspire you, make sure that you connect, improve probably your education and your knowledge. And I hope that you will step into the footsteps of Joinvasc and again bring Brazil to the top of value-based healthcare, but maybe even bring South America to the top of the value-based healthcare bit. Because that was what Porter mentioned when he did the honor of handing officially out the prize. And I think he hit it right on the nail, saying this is a wonderful example, for the value-based healthcare movement that's getting a lot of pace these days. It not only shows that Brazil is starting to lead in this effort, but also that South America is now quickly picking up and trying to get better results for patients, more inspiration in the teams, and trying to be as cost effective as we can. And I certainly hope that I will see many of you at the Value-Based Healthcare Prize in 2022.